He is a pediatric physician specializing in child abuse and has served as medical director for the Madison County Child Advocacy Center. She and her husband and 4 children reside in Jackson, Tennessee. Dr. Lisa graduated from Lipscomb University, completed her MD at ETSU, and holds a Master of Business Administration from Bethel University. She is currently a faculty member at Vanderbilt. In her spare time, Dr. Piercey runs triathlons with her husband. She likes to cook, and she is also a drummer, and you can't beat that for entertainment. Dr. Piercey today will give us some updates on the conditions of health in our state and what is next in curbing this crisis. We welcome today to BLTV show Dr. Lisa Piercey, Tennessee Commissioner of Health.
Thank you, Executive Haley. Thank you for having me and for taking the time to dig into this very hot topic. If it's okay with you, I'll hit a couple of high points on sort of what's on my mind right now, and then perhaps answer any specific questions that you may have. Man, we're really in the midst of this right now. Statewide, we're doing well. Early in the disease process, March, April, May, we started to see some pretty significant declines in the month of May, and in early June, stabilization. And then about the 3rd week of June, we really started seeing exponentially increased number of cases. And that is, by and large, because lots of people are moving about and going to what is, quote, back to normal. And I'm sure you've seen it as well as I have. There are pictures of kind of traditional graduations. There are photos of packed bars. There are pictures of big gatherings on beaches and lakes. And, people understandably are tired. They want, this has been a huge disruptor of our lives and for our families and for us personally, our jobs, the economy, everything. And so it is incredibly understandable that people want to go back to normal. But when you're dealing with this virus, this infectious disease that no one has immunity to, it is still incredibly dangerous to do that in the face of susceptibility. Almost the entire population is susceptible to it. So that would be, and I'll just take a little sidestep here, that's the number one differentiator of why this is not like the flu. You hear that all the time. At least you used to. You don't hear that quite as much anymore, that, oh, this is just like the flu, or it's similar to that, and it's not that big of a deal. Problem is that nobody has any immunity to this, not even partial immunity, and as opposed to the flu, which is, there's a vaccine for it. A lot of people get that, some people don't, but almost everyone, adult at least, has had the flu once in their lives, whether they knew it or not, and has at least partial immunity to that. And so when you have partial immunity, you either, or complete immunity, you either don't get the virus, or you get what we call an attenuated or lessened severity of it. And so when you have a population that has no immunity to the virus like we do now, then it really creates a lot of susceptibility. And so we're seeing really big numbers. Yesterday, we did record our highest statewide case count to date at just over 3,300 cases. But I want to tell you why that didn't send me running for the hills. Yes, there is quite a bit of sticker shock when you see that number. And in no shape, form, or fashion do I mean to minimize that number, because those are 3,300 people that are not only ill, but are also potentially contagious and infectious to other people. So, it's a serious issue. However, when you take that into context with the amount of tests that were done or resulted, they weren't done yesterday, but resulted yesterday, it was about 36,000 tests. So we look at what's called a positivity rate, or some people will call that an attack rate. And that's basically what percentage of the total did the positive cases make up. And I think yesterday's number was about 9.2%. That's about where it's been being. Now, that is up from where we were in May and June. In May and June, we were down in the 5 to low 6 range. And so positivity rate has definitely trended up, which means even despite increases in testing, there are more people getting sick. And so I don't want people to fall into the myth of, well, the reason the cases are higher is because we're testing more. While that is true, we are testing more and we're going to find more the more we test, the overall positivity rate is trending up. And in our metro areas, that can be in the mid to upper teens. And so it's something that we're watching, certainly. The other thing that we're watching that has created a lot of consternation, and it's really just hindering our efforts on the day-to-day basis, is the lab turnaround time. And this is something that's particularly frustrating because A, it's a national problem. It's certainly not unique to Tennessee, and B, there is almost nothing, and I'll say almost nothing that we as a state can do about it. Now, the reason I say almost is because we do have our own state lab, and there are some things that we can do to enhance throughput and decrease turnaround time in our state lab, and we're maximizing every single one of those. But a lot of that has to do with getting additional equipment. And these are big and expensive pieces of equipment, but it's important, and we're willing to and wanting to invest in that. But everybody in the nation is trying to get that same equipment right now. And so we've got waits for equipment. We've got orders that haven't been filled in several weeks. And so waiting for that to come in. We're even looking at some innovative ways of testing. It's probably too much detail to get into today, but some of your viewers may have heard of it. It's called pooling, and it's where you run multiple samples in the same tube, and then kind of divvy it up from there afterwards. And so it's a newer concept that helps us run more tests with the same amount of materials as you would maybe 5 in 1, or sometimes perhaps even 10 in 1. And so working through that to try to decrease lab turnaround time. Because let me tell you right now, if you've got a lab turnaround time of 7, 8, 9 days, well, guess what? You're probably well. Or conversely, you might even be hospitalized by the time you get the result back. You don't even know if you're positive or negative. The really scary thing is when you have that much of a lag, you are potentially infecting every person you come into contact with. That's a little bit exaggerated, but to make a point, you're putting others at risk if you're moving about while you're waiting on that result. Well, what's the alternative? The alternative, and quite frankly, it's the best practice, but it's almost impossible to execute every single time, which is you need to quarantine while you're awaiting that result. If you are sick, if you are symptomatic, you should be isolating yourself and assuming that you have it until proven otherwise. And I have a very acute realization of the economic and social impact of that, particularly on essential workers and people who rely upon, having childcare and being able to go to work and making arrangements. It is incredibly disruptive. So I say all that to say lab turnaround and throughput is something that is a current big challenge, and we're trying to explore every avenue to reduce that. Likewise, if we can't get a result until the 8th or 9th or 10th day, we can't start contact tracing until then. And so one of our key tools in combating the spread of the virus is contact tracing. And if we can't start that until the 10th day of illness, then that's pretty much a moot exercise anyway. Something else that we're really watching closely right now is hospital capacity. Because you have to remember how this all started. And I think people lose sight of it, but it's okay to focus on case count, but what we really always wanted to preserve is hospital capacity and health system ability to treat those that get sick. And this notion of flattening the curve was never about minimizing or eliminating cases primarily. We'd love for that to happen. We want that to happen and are trying our best to make that happen. But realizing that, just as I said at the top of the hour, essentially every person is susceptible to this and has a really high risk of eventually contracting it, short of a vaccine or therapeutic. We have to be able to spread that curve out over time, essentially flattening the curve, making it more like a plateau than a peak, so we can preserve our health system resources. That's hospital beds, enough doctors and nurses and staff. That's enough lab capacity. We've already talked about that. So it's making sure we can take care of all of the other things while we're dealing with this pandemic. And I'll remind you, people sometimes lose sight of it because it's out of sight, out of mind. There's still lots of people having heart attacks and strokes and getting new cancer diagnosis and having car wrecks and all kinds of summertime trauma. And so we have to be able to preserve our hospital capacity so we can take care of all of the normal stuff, plus this infectious disease burden on top of it. So how are we doing with hospital capacity? We monitor that both on a statewide aggregate level as well as in various markets. Because, you can understand if you get sick in Dyersburg up in the northwest corner of the state, you're probably not going to go to Knoxville to the hospital. So healthcare is local. We have to monitor that in the local market area. And what we're seeing is that particularly in Memphis and Nashville, but also to some extent in the Knoxville and Chattanooga areas, and now maybe even in Jackson, we're starting to see some stretching. I'm not sounding the alarm yet, but it's something we're watching. And do we have enough beds? Do we have enough ICU beds? Do we have enough ventilators? And the really important thing, and I spoke of it earlier, do we have enough staff? And is that staff healthy? Because you can have all the staff in the world, but if all the staff is sick and can't come to work, then you can't work those beds that you have. Right now, on a statewide level, we're doing fine from a hospital capacity standpoint. The Memphis and Nashville markets are starting to get, as I mentioned, stretched. Nobody's in in dire straits right now. There's still plenty of ventilators. We have a stash of ventilators here at TEMA that we can deploy in the event of an emergency. I don't anticipate that. And one of the reasons, and this is some good news, I haven't shared a lot of good news today, but I will give you this piece of good news, is that as cases continue to go up, although we are seeing increases in ICU and ventilator patients, they're not going up nearly, that curve is not nearly as steep as cases or hospitalizations. Well, why is that? That's because a couple of reasons, actually maybe several, but two that I'll highlight. One is in Tennessee at least, and starting to see it all over the country, we're having a younger age demographic. And as we all know, younger folks, particularly under 40, do pretty well with this. Now, there is the rare instance that somebody has a complication, and there are fatalities in that age range. But by and large, they're much less likely to be hospitalized. They're much less likely to have severe illness, and certainly less likely to be ICU in the ICU or ventilator dependent. So that's one, is age range. The other one is you have to remember, and this not only applies to hospitalization or hospital care, but other things as well. You have to remember we are learning as we go. And I made a comment early in this response about remembering. People don't say it much anymore, but this is called the novel coronavirus. Novel meaning new. We've never really dealt with this before. And so what we knew on March 1st, we know a heck of a lot more on July 1st. And that's good. We're going to know. I pray that we know more on October 1st than we do today. And so what that has done is it has caused us to change some of our recommendations, change our protocols, and I recognize that causes people to say, oh, hold up a minute. Why do you change it? Why are you saying something different now than you said in March? Well, because we know more. And I guarantee you, if you ask any man on the street, Do you want your doctor treating you the same way today as she did in 1982? No, we know more now, and it's the same kind of thing with this virus. We know more, and the recommendations have changed. So related to hospitalization, we know that actually patients do better if they're not on the ventilator. And for any clinicians that may be listening, you'll recognize that in almost every respiratory disease, sort of the general rule of thumb is go ahead and put them on the ventilator early. Give their body and their lungs a chance to rest and heal. That's a pretty general rule of thumb. It actually doesn't hold true for this disease. Of course, we all use that rule of thumb early in the disease process because that's how we treat every other respiratory illness. But we've learned that the longer you can put off the ventilator, or if you can avoid it altogether, the better the outcomes are. If you have to get on a ventilator for this disease, your chance of not surviving is really, really high. And some people can survive. I don't want to imply that it's a death sentence, because it's not. But once you get on a ventilator in the disease course of this, it's a pretty dire situation. So we've learned about how to treat hospital patients and how to make sure that they have the best outcomes, even better than they were 90 or 120 days ago. And finally, I'll close by saying one other thing that we've learned that is also a very hot topic these days, which is about face coverings, or some people call those masks. And so, it's the same kind of thing. In February and in March, we were saying, don't wear masks. That's not a good idea. The primary reason we were saying that, don't you remember that really big shortage that we had in what we call PPE, personal protective equipment? And at the time, we didn't really know much about the disease transmission. We knew it was droplets, and we thought, well, I'm not sure really how effective masks are. And the masks that we have, we absolutely have to save those for our healthcare workers, because you remember most of our PPE supplies come from overseas, and they were shut down in December and January, so the supply chain was interrupted. And so in the beginning of this, there was not that much traction around masks or face covering wearing. Well, that's another thing we've learned in the last 120 days or so, which is actually the way this is transmitted, masks or face coverings really do a really good job of preventing transmission. And now we don't have as much concern about PPE supply shortage. And I do want to make the distinction. There is a difference between surgical masks and N95s and cloth face coverings. We still should absolutely preserve our N95s for healthcare workers in those very high-risk procedures where droplets are aerosolized, et cetera. But we know more about how face coverings reduce disease spread. And there was an interesting study that came out of Japan. It was just one of them. There's been several. But with 50 to 80% mask wearing, disease burden is reduced by 80%. And I dare say that if you go out on the street corner today and say, would you do something if you knew that it would reduce this disease transmission by 80%? And they're like, well, of course I would, because I want to get back to normal. I want my business to go back to normal. I want my kids to go back to school. I want to be able to move about freely. And that's what we've discovered that mask wearing does. Now, I did say 50 to 80%. That means more than half of people need to start wearing it to be effective. But the one final tidbit that I'll leave you with, that in this study from Japan, once you had that for a certain number of months, the disease was completely eliminated. So I'm not purporting that masks are the be-all, end-all miracle cure of this. They are a really incredibly effective tool. And so, I can't, I said that was the last point, I'm sorry. Ask my husband, he knows I'm never done talking. But I'll add one more thing about that, because I'm sure it's also top of mind for lots of folks, which is, well, Dr. Piercey, if masks are so effective, why don't you just mandate them statewide? That's a legitimate question. And the approach that we've taken, it's very clear when you look at the data on our website or other sites, is that one size doesn't fit all in Tennessee. We have got some of our rural counties, I haven't looked in the last few days, but as at the end of last week, they were still in the single digits, 8, 9, 10 cases. And so those counties are still, 10 or 15 cases, very, very low rates. Then we have some of our areas, particularly our metro areas, that are in the 13 and 14,000 range. Obviously, the population sizes are different, but we have many, many different shapes, styles, and forms of counties and populations in Tennessee. And so we want that to be a local issue that is decided locally, and we want to give encouragement to do that whenever possible. And the other thing that you have to remember is you really need to do it before you see the problem get bad. Because once you've got a bad problem and once your case count really starts ramping up, you're just starting to chase your tail then. The best time to do a mask requirement and to really encourage masking is before it gets bad, to prevent it in the first place. So I'll stop there and answer any specific questions that you would have, Executive Haley. Thank you.
Thank you very much, Dr. Piercey. So a lot of good information. One of the things that we've been doing locally, of course, there's been increased testing because I've encouraged it across the community, but our health department is only operating the hours of 9 a.m. to 11 a.m. Yesterday, of course, they tested 148. I went back and got my monthly test. But is there any hopes of expanding those hours? I know because of the volume of testing being done, and we've talked about the lag time, a lot of people have become frustrated by sitting in line with 20 to 30 cars in front of them. And is there any plan to expand local testing at our health departments?
So that's a good question, but I'm going to have you take a step back and think about what we're talking about here. We're talking about a medical test, and of course, the health department is a medical facility, and it's appropriate for them to do testing. But when people are sick, they really need to be seeking care at their doctor and at their normal health care provider the system. And so just like you would with a flu test, if you think you've got the flu, you're probably not going to go to the health department, although they do those at the health department. You're probably going to go to your provider clinic or a walk-in clinic. And so the reason the health departments, and this is true for all states across the nation, the reason that there was such a public sector or governmental focus at the beginning is because nobody else had the test, and nobody else could get the supplies that we were able to get from the federal government, et cetera. And so we were stepping in the gap and filling that. It's still meeting an incredibly important need. But what we are seeing over time is that fewer and fewer and fewer tests month over month are being collected at health departments and in these wide community events, and many more are being collected in the healthcare system. That is the sustainable approach, which is, it, just like with any condition, if you're sick, go to your doctor, go to a walk-in clinic or the ER and get your test there. So we'll continue supplementing, but right now, with a month-over-month decrease, except for a few surges here and there, we're probably not going to be expanding hours at the health department. But that, never know. I've stopped predicting the future here because I've been wrong a lot lately. And so if the need goes up, we'll certainly look at that again.
Thank you. Another thing about rapid tests, fast-track testing, is that going to be available anytime? With schools reopening and us trying to keep essential government services provided to our residents, it's very hard when we have a possible case and we wait 8 to 10 days for results. It can cause complete shutdown of operations for the county or a department. And of course, it could keep the school system from reopening as is scheduled. So any news on rapid testing?
Well, there is some optimism surrounding rapid testing. We had a call with the White House yesterday, and they referenced potential increase in supplies of rapid testing for the market, just the market at large, in the next 2 to 3 weeks. So that's encouraging. And we are starting to see more rapid testing available from community providers. There's a couple of points you have to remember about rapid testing right now. And again, I hope this is not the case 90 days from now, but it is true right now, is that the rapid tests have less sensitivity. And some people will improperly use the term accuracy. The proper term is actually sensitivity, which means essentially if you're positive, how likely is it to pick it up? And whereas the sensitivity of the traditional test, the one that you correctly mentioned, has a longer lag time, the sensitivity of that test may be in the low to mid 90s. So 92% or so is a reasonable estimation. When you start doing the rapid test, you lose sensitivity pretty quickly. It may be closer to the low to mid 70s. So what that means is maybe 1 in 4 or 1 in 5 at best that you miss a positive. And so the recommendations right now are actually, if you have a negative test, rapid test, you still have to send off a traditional test and get a negative on that before you can confidently say this person is negative. Now, you may say, and you would be right in saying, well, that's just the trade-off that we're willing to accept, less sensitivity for more rapid results. And that's true, and we take that risk all day long because of the benefits of rapid testing, as you've just described. The other important thing to remember in here is that if an employee or person or child or anybody is symptomatic, they need to isolate until they get a result back. And it's very important to remember that, because if they are, I know we want to get people back on the job, we want to get kids back in school, but we want to do it in a safe manner. And if they are symptomatic, they do not need to be around other people until they get that negative PCR result, which is that traditional test, because it's just too high of a risk of disease spread. So while I'm oftentimes asked, hey, can you help me get a real fast test? I don't feel good, and I just want to make sure that this is, not sinuses or a cold or whatever before I go back to work. No, if you're sick, you need to stay at home, regardless of fast test or not. So in summary, rapid testing is starting to come online a little bit more frequently, and the supplies are a little bit easier to get. I'll emphasize a little bit easier to get. They're still not widely available, but it's getting better and hopefully be in a much better position in the next 30 days or so.
Thank you. Another question, what about antibodies tests? What do you think about antibodies and the research being done with that? And is that going to be available anytime soon? Or are we going to depend upon Red Cross and blood assurance and private providers to do those antibody tests?
So you said one word in that question that is key when talking about antibodies right now. Now, I do want to preface my comments by saying what I'm about to say is true today on July 14th or whatever today is. It may not be true on September 14th because we're going to learn more by then. But right now, antibody testing is best used in research settings for what we call disease surveillance. I know the word surveillance makes everybody nervous, but that's a common term in infectious disease. It's basically like, how is the disease moving across our population? And so it's really good when you look at it from an overall standpoint to give a general estimate of how many people in a state or in a region have been infected and may have immunity to it. Keyword there is may. So there's a couple of things we don't know about antibody testing. One is if you have the antibody, does it mean that you're immune? Well, I mean, everybody kind of assumes that it does, but we're not 100% certain about that. And if you do have the antibody, and if you are immune, how long does that last? Does that last 6 weeks or 4 months or for the rest of your life? We don't know that either. So while it's good in general purposes, it's not really great on the individual level. And I'll tell you another reason why. This is probably the most shocking thing I'll say today because it really blows my mind every time I think about it. antibody testing in Tennessee right now, where the prevalence, the overall prevalence in the state is still pretty low. I mean, when you talk, it feels high, but when you compare it to like the New Yorks and New Jerseys or even Louisianas or Floridas of the world, we've got a pretty low prevalence. And when you're talking about prevalence, folks out there who are familiar with math, statistics, you'll recognize the term pretest probability. So when you have a low pretest probability, current antibody testing in Tennessee is only about 26% accurate. If you do two tests, you can get up to 49% accuracy. Well, guess what? You could guess with better accuracy than 49%. You could guess one way or the other and be a little bit, you can be right half the time. So while antibody testing is, it's pretty much widely available across the state and has been for several months now, primarily through private providers, it's really not great to interpret on the individual level. That's why you haven't heard us talk about it very much. We don't report those numbers either separately or in our case count, as some states do. Hopefully, that science is going to get better and they're going to become more accurate, and we can use that as a tool in the future. But right now, it's not high on our radar. Okay,
thank you. One last question before you sum up your recommendations for us. Warren County did quite well at the very beginning of this pandemic. We kept our numbers low. We were very proactive at the very beginning. But when the economy reopened again, we saw surging numbers. And right now our count is 159, and that's doubled in about a week's time of positive tests. Of course, I've been trying to look at the data and the research, and the governor's executive order 54 gives county mayors emergency powers to enact a mask mandate. When do you think it's necessary, in your opinion, as a medical doctor and an expert, with the information you've shared with us today, when do you think it's necessary to issue a mask mandate? What numbers, what metrics should we be looking at? Because it's very hard to enforce in a rural community, but we've tried to recommend, and the number of people wearing masks is probably, minimum compared to what it should be. So when do you think a mask, what numbers should we be looking at? What metrics should we be analyzing to make that decision?
Well, that's a great question, and one that, as you can imagine, we get asked a lot. And so I'll tell you kind of the two things that I can say from my standpoint. First of all, as I mentioned earlier, mask wearing needs to happen before you think you need it. Because once the case count is going up, like you've just described, it's still effective, but you're already behind the eight ball. So while I realize that's not a number or a certain threshold or metric, I promise you need it before you think you do. And people need to be wearing them before they think they do, is what I should say. The other caveat I will give is, you're asking, I say this a lot, and it irritates my friends, particularly in the political realm, but I'm a doctor, and so I give medical advice. And I also recognize that medical advice it's not the only consideration. There are a lot of societal and political considerations. There are social and enforcement considerations. From a medical standpoint, we know that face coverings are incredibly effective, and I dare say you'd be hard-pressed to find any kind of medical provider or clinician that is well-versed in this area that's not wearing them, because we're all wearing them full-time. And so, I try to lead by example. I have 4 teenagers, which is really hard to get them to wear masks, but I want them to lead by example for their friends, too. And so those would be my pieces of advice, is you need them before you think you do, and we know it's a really effective tool, and so from a medical standpoint, they're always warranted.
Thank you very much. Of course, these are such challenging times, and I know it's been extremely hard on you and the governor, his command task force, his economic recovery group, everybody. This is, like you said, a novel virus with lots of ever-changing information on a daily basis. What do you see down the line? What hope can you give us? What is the next thing for us to be considering, or should we be addressing?
Sure, that's a good question. And I'm glad we're going to end on some hope, because I haven't done a good job of inspiring hope today. But you know, I think before I get to that, I want to close with sort of our overarching principle. And I just referenced it a minute ago. I give medical advice, but there are other things to consider, like economic impact. And so there's always this tension, and I'm not specifically in our administration, but just in general, conceptually, there's tension between medical recommendations and what we know we need to do for the economy. Bottom line is, we're going to be living with this virus for the foreseeable future until we get a vaccine or therapeutics, which I'll talk about in just a second. But for the next several weeks or months, we're going to be living with it. So we've got to shift our mentality from, we've got to get back to normal, and I want all this to go away. Trust me, we all want this to go away.
Yes, we do.
But in the short term, we have to learn to live with it. And so what are the things that we can do in order to keep our businesses open, in order to keep our kids back in school, and doing the things that we love and enjoy? What are the steps that we can take to be able to do those safely? Now, the good news. As you may have seen, I had the extreme honor and privilege of going to the White House last Tuesday and meeting with Secretary Azar and Secretary DeVos, as well as President Trump and Vice President Pence, about school reopening. And in the course of that conversation, Secretary Azar of HHS gave a little update on where we are in vaccines and therapeutics. So vaccines are, pretty much everybody kind of understands that concept, sort of the same concept as a flu shot. We're not exactly sure yet, once a vaccine comes out, how long it will last, if you'll have to get it every year, or if it'll last 3 years or 5 years or the rest of your life. We don't know that yet. But what we do know is that there are now at least 4 vaccine companies that are in human trials. And they've really accelerated. You may have heard of this Operation Warp Speed. FDA and the federal government has really accelerated those several first phases to get it to the point of human trials. Now, what you can't do is you can't rush a human trial, because you have to do it in a big enough population to be able to study both effectiveness and safety. That's going to take some time, but with 4 companies in human trials right now, Secretary Azar suggested that by the end of this calendar year or the beginning of 2021, that we will be pretty close to having a widely available vaccine. That feels like a really long time from now, but this has been a remarkable development to this point as compared to other vaccine development. But we don't have to necessarily wait on that in order to have some hope. You may have heard of remdesivir. Remdesivir is an antiviral medication that's actually being used in hospitals right now. It is best suited for the sickest of the sick, so those in the ICU and on the ventilator, but it may save perhaps up to 30% of people that would have normally died. It might be life-saving for them. And so our hospitals in Tennessee have access to remdesivir, and within the next 2 to 3 weeks, they're going to be able to start ordering it directly from the wholesaler instead of having to get it through the federal allocation of the state health department. And then finally, maybe the most timely news that Secretary Azar was able to give us is that the development of a monoclonal antibody may be ready as early as September. Now, I'll give you a very basic overview of what that is, and for the medical folks out there, I admit that I'm overgeneralizing just to make sure people understand. But if you think about the concept of convalescent plasma, and I'll take a sidestep and tell you, if you've had the disease, you need to go give plasma, because they do take the antibodies from that, and it can help people when you give direct antibodies to somebody else IV form. So if you've had it, friends and family have had it, you need to go give plasma. It's a very easy and effective treatment. But a monoclonal antibody basically takes that same concept of taking the antibodies from somebody that has had a recent infection and making it in the lab and then being able to give it to people to help fight off the virus. So while it doesn't prevent anything, it does reduce the severity of the course and perhaps even prevent infection in those that may have been exposed and have early infection. So that could be ready as soon as the next 60 or 90 days, which is incredibly encouraging. And I'm staying really closely tuned to that news because that'll be a big win for us. So I'll stop there, and I want to thank you again for what you're doing, not only to respond to this, but also to support your community and your economy during this really stressful and difficult time. But you know what? We just got to be kind to each other, give everybody an extra measure of grace, particularly the teachers and those who are really grappling with some difficult issues right now about going back to school, and giving everybody a little bit extra measure of grace will help us get through all this.
Thank you very much for joining us today. We'll continue to monitor your updates and look at your reports from the Department of Health on a daily basis. And Dr. Piercey, thank you very much for your service and joining us today with some very important information to share with all of our residents. So take care, and you be very safe.
You too. Thank you, sir.
A lot of information shared with us today. We've got updates now from Dale Humphrey, who's CEO and Administrator of River Park St. Thomas Ascension. And then we'll have Grant Swallows as Director of Schools for Warren County, and Nolan Ming, City Administrator for the City of McMinnville.
Thank you, County Executive Haley. Good morning. As Mr. Haley mentioned, I'm Dale Humphrey, CEO of St. Thomas River Park Hospital. As was mentioned, and many of you may know, the statewide testing numbers in Tennessee continue to grow, and we currently stand at over 1 million people tested in our state. There have been 65,000 positive cases so far. 3,200 patients have been hospitalized, and almost 37,000 have recovered. There have been 749 deaths in Tennessee. I think it's important to note the highest percentage of positive cases are in the 21 to 30-year-old age group at around 24%. And I'd also like to point out the only age group that hasn't experienced a death from COVID-19 is the 11 to 20-year-old age group. So it does affect everyone, although the older population is certainly at higher risk. In Warren County, 4,159 citizens have been tested. As was mentioned, 159 patients have tested positive and 66 have recovered. Unfortunately, I'm very sad to report to you I'm aware of at least 2 deaths from COVID-19 already in our county, and expect that we will see some more before we are through this pandemic. At St. Thomas River Park, we do encourage those of you who have delayed getting care to seek treatment so that we can appropriately take care of you and get the follow-up care that you need. We are seeing sicker, higher acuity patients in our emergency department and hospital, and we believe that much of this is due to people deferring their treatment or avoiding their primary care physician during this pandemic. We continue to require all patients, visitors, and staff to wear masks in the hospital at all times, and we've also gone back to limiting visitation in our emergency department to only certain circumstances, such as a parent or guardian accompanying a minor, a patient near the end of life, or a loved one assisting a patient with dementia or other behavioral deficits. We have now treated several patients within St. Thomas River Park who are COVID-19 positive. We are seeing more positive cases in every hospital and clinic within St. Thomas Health. Laboratories testing for COVID-19 has also been stressed, as Dr. Piercey mentioned, and more people getting tested. But gratefully, our Warren County Health Department continues to offer the testing from 9 to 11 Monday through Friday. Currently at River Park, we also have no patients on a ventilator, even though our volumes are up. We do have capacity within the hospital, and we also have access to remdesivir, as was mentioned earlier, being an effective treatment. I know we're all weary of this pandemic. but I strongly encourage you to wear a mask anytime you are in large groups and continue to practice social distancing and hand washing. Locally, we have seen businesses as well as churches be forced to close temporarily due to outbreaks of positive cases. Please continue to stay safe and vigilant and understand that we will all need to have patience as we continue to deal with the COVID-19 pandemic. God bless you all and stay safe. And again, now I'd like to introduce Mr. Grant Swallows, Director of Warren County Schools. Thank you.
Thank you. Thank you for the opportunity to be here and to speak to you. Appreciate County Executive Haley and his leadership. I also appreciate Dr. Piercey being on with the great information that she was able to share. I also appreciate her help in asking for grace. At this point, I want to update you on where we are as a school system. A couple of weeks ago, I presented a plan to our school board for reopening our schools. It is just that. It is a plan. We've worked extremely hard as a district and district staff over the course of the last month and a half to prepare this plan in order to get our students back to school safely and securely. And as well, we know the importance of our students needing to be educated. That's the two prongs of this that have to work in conjunction with each other. Safety and security for all, and also we know the need to be able to educate our children appropriately. We're coming out of a time where we had to shut down our school buildings, and we faced issues that we never faced before in being able to help our kids learn. So that's what we're preparing for. That's what we've been preparing for. Our school board did adopt a plan to return to school traditionally with safety measures in place as of August the 12th. And in order to do that safely, we feel like that phasing in our students is the right thing to do in that regard. How that will work is I sent out a press release at the end of last week trying to explain that. I realize that there are a lot of questions around that. We want to answer those. My encouragement to you today is to reach out to me, reach out to your local school so that we can explain that. Our phase-in process will begin on August the 12th with half of our students in the building and the other half learning remotely. Students with the last names that begin A through L will report on Mondays and Wednesdays to the traditional environment. They will learn in the remote environment on Tuesdays, Thursdays, and Fridays. And conversely, students with the last names that begin M through Z will learn in the traditional physical building on Tuesdays and Thursdays, in the remote environment on Mondays, Wednesdays, and Fridays. We plan to do that phase-in process for 2.5 weeks, provided that we are able to, based on the information coming in to us from local and state and national leaders based around what's going on. I want to reiterate, our reopening plan is just that, a plan. We are going to continue to monitor it. It is fluid. Information is changing on a daily basis. And so I want the folks of our community to understand that we are going to continue to monitor and make the best decisions to keep our students and our staff safe as we go back to school. If we are able to return traditionally with safety measures, we would return on August the 31st. That's a Monday, where all schools and all students would report 5 days a week at that time. There will be safety measures involved. We will be requiring social distancing. We will be expecting masks, especially in situations where students and staff are not able to social distance. We are working extremely hard. Our schools, I hope that you will be thankful for the educators in our district and how hard they're working to return our students to the vital need of being educated. Our schools are working diligently to create safety plans and plans for instruction throughout this summer, and they will continue to do that all the way up until we're able to go back to school. Another exciting part of this is that we understand that students are at risk health-wise. We understand that students are staying at home or are living in homes with adults who are at risk, and so we are going to be able to provide an opportunity for students to learn remotely if they so choose. We have an application process that's on our website. It's also being circulated via social media for those students that feel like they need to start the year through our VIP at Home program. That basically means virtual instruction program at home. Students will be learning from home via computer, via internet access. And so we have a lot more information about that on our website as well. There's been a lot of questions about that, and we want to answer those. We encourage you to reach out to us in order for us to do that. There's going to be a lot more information coming forward. I just want to echo what's been said before. Lots of folks want to return to school. We also understand there are other folks that are apprehensive about that. We want to work together to make sure we're providing for our students. The best way to do that right now is for us to social distance and to wear masks. You will see us model that for you and model that for our students as we return. So I'm asking you, for the good of our students, for the good of our community, for you to consider that and to do the responsible thing so that we can return our kids. They need to be in school. They need to be learning. As important for our economy is to grow, it's just as important for our students to be in school, not only to learn, but to have the experiences that they have and the learning opportunities they have through our school. I encourage you to reach out to me if I can be of service to you, answer any questions. We will be giving you more information as we can. I appreciate the opportunity to update you this morning and ask that everyone take care of themselves and be well. Thank you.
Thank you, Mr. Swallows. I'm Nolan Ming, City Administrator, City of McMinnville. And at the city, we're currently operating at Level 4 of our COVID-19 action plan, with Level 4 being normal operations and Level 1 being the highest or most critical state of operations. This plan is intended to escalate gradually to proactively respond to changes in the situation while heeding the guidance and recommendations of our federal, state, and local public health officials. While we are now at Level 4, we're monitoring the situation regarding the dramatic increase in cases and testing positivity rate, and this could change soon. City employees are required to wear face coverings when appropriate. At Level 4, all lobbies are open, so that includes 202 Bell Street for utility, bill, and tax payments, 1266 Belmont Street for planning, zoning, and building and yard sale permits, as well as public works inquiries, and the police station at 204 Red Road. Utility bills can also be paid online at our website, mcminnvilletn.gov, by drop box at 101 East Main Street or 202 Bell Street, or several banks throughout McMinnville that accept city utility payments. The following facilities remain open. All classes in the Wellness Center at the mall, but at reduced capacity to allow 6-foot minimum between patrons. The facility opens at 8 a.m. for classes, 9 a.m. for the fitness center, closes between 1 to 2 p.m. for cleaning, and then reopens until 8 p.m. The bathrooms at Riverfront Park, Pepper Branch Park, Ramsey Park, and the Civic Center are open. The skate park, tennis courts, and all ball fields are open. Playgrounds are open, and the Gilly Pool is open from 10 to 5, Monday through Saturday, and on Sunday, it's 1 to 5, with a maximum of 300 patrons at any given time. Many projects continue, including the Civic Center, which is roughly 75% complete, the dog park near Pepper Branch Park, the City Hall elevator, which is expected to be completed by the end of August, at which time Regions Bank will be out and the city will be back. We'll be relocating all city staff back to City Hall. And planning continues on the Magnus Drive Extension project, which includes reconfiguration of the intersection of the bypass, the mall entrance, and Sparta Street. And I believe we're still a few years out on the construction start, but we are still working through the planning phases on that project. The Center Street Sewer Repair Project, Pre-construction meeting was held last week, and work is expected to begin in August or September. That's a large, very large sewer repair project. And the TDOT resurfacing of Morrison Street. This will include repaving and bike lanes. So the pre-construction meeting for that project is July 27th. So several things happening at the city still. That's all I have for today. I want to thank our elected officials and employees for your understanding, flexibility, and unwavering commitment to getting the job done safely. Thank you as well to the public for your understanding and flexibility as we work through this unprecedented pandemic together. If you have any questions or concerns, please contact us at 931-473-1200 or message us on Facebook. Thank you.
I want to thank all the members of our preparedness team who have worked so diligently over the last 4 months to be as proactive and essential in all of our activities, our research, and our actions. Constant communication has kept us ahead of most of what is out there and has allowed us to act as effectively as we could. We still, however, face some serious and some critical decisions within the next few days. There must be much consideration taken towards some of the mandates and the shutdowns that may come from the state. But it's going to take all of us together, working together as a community in order to effectively make sure that what we're doing is proper, because the safety and protection of all of our residents is our #1 priority. I want to thank all the healthcare providers in the front line of defense, including our law enforcement, over these course of the last 4 months. Warren County does have 159 confirmed cases, and that has doubled over the last week or so. The reopening of the economy has been a catch-22, containing basically the inevitable rise in numbers as our residents have wanted to assume business as usual. Unfortunately, we have had some mixed signals from both Washington and Nashville, and it's been hard to sometimes unravel the confusion linked to the COVID outbreak and the political ramifications of this crisis. But we can't have it both ways. We can't be wide open and business as usual and basically combat this virus effectively. For the county, all during this time, we've had essential services provided, and our operations will continue to be such, with some restrictions on hours and facility access in order to protect employees. In my building in the admin, it's Tuesdays and Thursdays without appointments. You must walk in, sign in, temperature checks, wear a mask, use hand sanitizer, and we limit the number of people in each office. I know how everyone wants everything to go back the way it was, but the courthouse and other departments are having to operate on their own operation schedules, so please continue to call those offices if you have questions. I know that everyone understands why we have to take these precautions. As this crisis has grown, if government employees test positive, it will require the closing of certain departments and the eliminating of certain services for a period of time. That will not be an easy decision to make, but I think all residents will have to make accommodations to that shutdown and will understand why we are doing this. My #1 priority during this entire ordeal is to basically protect the safety and security of every man, woman, and child in Warren County. But I can't do it without you. And this is our call to action. If ever I needed you as a community to stand behind what we're doing and what needs to be done, I need you now. Tennessee is the volunteer state. We're proud of that spirit. We're known as the pioneers in Warren County. And that teamwork and determination has defined us over the course of the last 200 plus years of our history in Tennessee and this county. Our motto has always been to roll up your sleeves, pitch in, and get the job done. And this is where I need you. I need your help. I need your assistance. I need your support. I want to recruit you to be my volunteer troops, my foot soldiers in the field, in order to combat this deadly disease, this COVID enemy. You must assist in our community efforts. It's a simple strategy. Dr. Piercey said it earlier. Wear a mask. It's the most effective thing that you can do as a community. It lowers the transmission rate and makes us safer as we engage in social activities. Use personal hygiene and sanitizer. Stay at home when possible, particularly if you have health challenges. Avoid social gatherings in large groups, particularly those who are not practicing the proper guidelines. As far as businesses, please continue to follow the Tennessee Pledge to protect you, your employees, your customers, and your livelihood. Your success is our success. We do not want to see further business shutdowns, not anywhere in Warren County, not anywhere in Tennessee, not anywhere in the country. But it may be necessary. As you know, I was an economics teacher and government teacher for 40 plus years. I have loved and nurtured many generations of students over the course of my career. I care about each and every resident in this county. We are all one people. Our lives depend upon a few simple things, and no one wants to take away any freedoms. We want to protect you. We want to guide you. We want to make this a safe community for ourselves, our children, each and every one of us. But without that protection, there may be a bleak future ahead. Dr. Piercey outlined that. We've got to do what is needed. This economy, nor our lives will ever improve until this virus is contained, until there's vaccines, until we understand it more, hence the novel virus. We cannot send our kids back to school unless this virus is contained between now and August on those opening dates. The only way we're going to return to any semblance of order in our lives if we face the facts that have been laid out in front of us and take action as an entire community. This is my call to you, Warren County, to do the right thing, to be volunteers, to be those pioneers. It's a symbol of who we are as a community. As Churchill said to Britain on the onset of World War II, give us the tools and we will finish the job. Warren County residents, you are the tools that we need to finish this job. Our success depends upon your support, your cooperation in doing the right thing. If we use these simple tools, make a few personal sacrifices, it's a simple cause to save our community and to unite as one to combat this viral enemy, we can get this job done. Our fears should never hold us back from obtaining our hopes. It is all about choices now. We can see what success can be had by witnessing what other communities have done to be proactive and take action. Simple guidelines, simple mask wearing. We will see and reap the benefits of those simple actions. As always, we will all continue to monitor the health reports and the numbers, and I will act accordingly. The Governor's Executive Order 54 gives me authority to act during this emergency across the entire county. The mandates will not be necessary if we take the necessary strides to mitigate this crisis. If you will be my little volunteer soldiers and troops out there doing what is needed to be done. Simple things will accomplish this task more than drastic measures, but I will do what I have to do. Decisions will be made that may not be what everyone wants it to be. It may be contrary to what your personal philosophies are. But as a community, if we don't act, we know what is in the future. In the meantime, we will continue to work with health officials, law enforcement, first responders, our first line of defense folks, and elected officials to enact a heightened plan of action that will be unveiled when time is necessary. Your prayers are important now, but as I always say to my church members and people out in the community, sometimes you have to put actions to those prayers. We can do this, I have no doubt. We are a remarkable community who has made great strides over the course of the last few years for progress and change, investing in our future, investing in children, investing in a better tomorrow for all of us. But we've done it as a team. We've done it as a collective unit. We've done it as a community that believes in ourselves. So listen to my call of action. Take every precaution. Use the mask. Use the social distancing. Do what is necessary, and we will get through these hard times. I'll leave you with a quote from JFK. I'm not here to curse the darkness, but to light the candle that can guide us through this darkness to a safe and sane future. We are America strong. We are Tennessee strong. We are Warren strong. Thank you.